Anal cancer. Anal cancer is a rare type of cancer that affects the very end of the large bowel. Symptoms of anal cancer. The symptoms of anal cancer are often similar to more common and less serious conditions affecting the anus, such as piles, hemorrhoids, and anal fissures, small tears or sores. Symptoms of anal cancer can include 1. Bleeding from the bottom, rectal bleeding. 2. Itching and pain around the anus. 3. Small lumps around the anus. 4. A discharge of mucus from the anus. 5. Loss of bowel control, bowel incontinence. However, some people with anal cancer don't have any symptoms. Speak to your GP if you develop any of the above symptoms. While they're unlikely to be caused by anal cancer, it's best to get them checked out. Diagnosing anal cancer. Your GP will usually ask about your symptoms and carry out some examinations. They may feel your tummy and carry out a rectal examination. This involves your doctor inserting a gloved finger into your bottom so they can feel any abnormalities. Your GP will refer you to hospital if they think further tests are necessary. The National Institute for Health and Care Excellence (NICE) recommends in its 2015 guidelines that GPs should consider referring someone with an unexplained anal lump or anal ulcer. The person should receive an appointment within 2 weeks. If you're referred to hospital, a number of different tests may be carried out to check for anal cancer and rule out other conditions. Some of the tests you may have include a 1. Sigmoidoscopy, where a thin, flexible tube with a small camera and light is inserted into your bottom to check for any abnormalities. 2. Proctoscopy, where the inside of your rectum is examined using a hollow tube-like instrument, proctoscope, with a light on the end. 3. Biopsy, where a small tissue sample is removed from your anus during a sigmoidoscopy or proctoscopy so it can be examined in a laboratory under a microscope. If these tests suggest you have anal cancer, you may have some scans to check whether the cancer has spread. Once these are complete, your doctors will be able to stage the cancer. This means giving it a score to describe how large it is and how far it has spread. What causes anal cancer? The exact cause of anal cancer is unknown, although a number of factors can increase your risk of developing the condition. These include 1. Infection with human papillomavirus, HPV, a common and usually harmless group of viruses spread through sexual contact, which can affect the moist membranes lining your body. 2. Having anal sex or lots of sexual partners, possibly because this increases your risk of developing HPV. 3. Having a history of cervical, vaginal or vulval cancer. 4. Smoking. 5. Having a weakened immune system, for example, if you have HIV. Your risk of developing anal cancer increases as you get older, with half of all cases diagnosed in people aged 65 or over. The condition is also slightly more common in women than men. How anal cancer is treated. If you're diagnosed with anal cancer, you'll be cared for by a multidisciplinary team. This is a team of different specialists who work together to provide the best treatment and care. The main treatments used for anal cancer are 1. Chemoradiation, a combination of chemotherapy and radiotherapy. 2. Surgery, to remove a tumor or a larger section of bowel. In cases where the cancer has spread and can't be cured, chemotherapy alone may be considered to help relieve symptoms. This is known as palliative care. Chemoradiation. Chemoradiation is a treatment that combines chemotherapy, cancer-killing medication, and radiotherapy, where radiation is used to kill cancer cells. It's currently the most effective treatment for anal cancer. You don't usually need to stay in hospital when you're having chemoradiation. Chemotherapy for anal cancer is usually given in 2 cycles, each lasting 4 to 5 days, with a 4-week gap between the cycles. In many cases, part of the chemotherapy is delivered through a small tube called a peripherally inserted central catheter (PICC) in your arm, which can stay in place until your treatment has finished. Surgery. Surgery is a less common treatment option for anal cancer. It's usually only considered if the tumor is small and can be easily removed, or if chemoradiation hasn't worked. If the tumor is very small and clearly defined, it may be cut out during a procedure called a local excision. This is a relatively simple procedure, carried out under general anesthetic, that usually only requires a stay in hospital of a few days. At the end, it is requested you to please subscribe our channel.